Hi, Jeremy.
Hi.
Good to see you today. How are you feeling?
I'm doing okay.
Okay, so I have here on my chart that you're having a little bit of shoulder discomfort. Is that correct?
Yeah.
Did anything happen specifically?
I've just been working out at the gym,
Okay,
and so it's been sore after that.
just the one shoulder there, the
Yeah,
left
just my
shoulder?
left shoulder.
And when did that soreness start for you?
A few days ago.
A few days ago. Is it is it just a soreness? Is it a pain? What does it feel like? Sharp, dull?
Yeah, it's probably a dull pain.
Dull, more like an ache.
Mm-hmm.
Okay. And on a scale from 1 to 10, 1 being no pain and 10 being excruciating pain, where would you say that dull ache is?
3, 4, possibly a 5.
Okay, so sometimes it's pretty uncomfortable.
Mm-hmm.
Okay. And have you done anything to make it better? Icing, heat,
Yeah, I've done some
ibuprofen?
icing and ibuprofen.
Okay, and is that effective at all?
Yeah, it helps.
Okay. So your main concern today is just making sure there's nothing more serious going on. So you want to continue working out, essentially, right?
Hopefully.
Yeah. Okay. So we'll make sure that there's, no signs of tearing or fractures or anything that could lead to a more serious injury if you put pressure and weight on it. And then we can do a little bit of a massage and therapy on it if it is just sore, if it is just a little bit of a tendonitis type of thing. If it is something more serious, then we will do a different treatment, okay? All right. So Jeremy, I'm just going to first, with the sweatshirt on here, just do a little bit of palpation. Any shooting pain when I press here?
No, but it's sore.
Soreness? Okay. And does that elicit that soreness on that 3, 4, 5 scale? Or is it a little less?
It's a little less right now.
Okay. When was the last time you used the shoulder for any weightlifting or anything like that?
Probably like 2 days ago.
Okay. Just feeling it. Any pain into the back here?
Mm-hmm.
A little bit into that shoulder blade?
Yeah.
Okay. What about into the front here?
Mm-hmm. A little bit.
So it seems muscular to me. So that's this big muscle that goes across and down the front of the shoulder here. What about down the arm? Anything?
No, that's okay.
Okay. I'm just going to touch the other side for comparison. I just want to feel if there's any major swelling. No pain on this side, right?
No.
And that's all okay?
Mm-hmm.
All right. So Jeremy, I'm going to have you remove this arm out of this sweatshirt for me so I can take a look at the shoulder itself, okay?
Okay.
Is that all right like that?
Mm-hmm.
I'm just going to roll this up. I'm sorry, my hands are a little bit cold here. Just looking for any obvious bruising, injury. You said you didn't do anything to it, right? You don't remember hitting it or popping it at all?
No, just lifting weights.
And then feeling the soreness afterwards?
Mm-hmm.
Okay. Again, we're just going to compare on the other side very quickly. That all looks fine. Again, just looking down the arm, looking for any bruising or drainage that might have shown me that there was a past injury. A lot of times fluid will build up, will drain down the arm as the bruise heals, but no, everything looks fine there. Just gonna roll this up. And you said that it's, in here, like right about here, right?
Mm-hmm.
Okay. I'm just going to press a little bit harder now. Is that worse?
Mm-hmm.
Okay. What about on the front here?
Mm-hmm. Right there.
Okay. And is it as bad on the back?
Yeah.
It is, okay. It's that whole band right here. I'm just going to be hitting my own hand. I want you to tell me again if there's any shooting pain. And what I'm looking for is a nerve response.
Yeah.
A little bit of a nerve response right there.
Mm-hmm.
Okay.
Right there.
That's okay.
That kind of starts.
Down the back again.
Mm-hmm.
As I get to the center here, how does that feel?
It feels fine.
Okay. Same thing down further feels okay.
Mm-hmm.
It's really this muscle right here that comes right across the shoulder is definitely a little bit inflamed. Maybe pressing on that nerve there. Just feeling for temperature. Pretty consistently warm, maybe a little bit warmer up here. And just relax for me. The surface temperature is pretty consistent, so I'm not super worried about any infection or anything like that. I'm just going to feel some pulses here. Just relax into my arm. So we'll compare side to side here. That's totally normal. So blood flow seems to be fine as well. Definitely feeling like it's a muscular nerve issue, at least at first. Can you do some movements for me? I just want to check the range of motion of the arm. And just go up with your arm like that. Does that cause you any pain?
Mm-hmm.
Okay. Go ahead and relax. Can you come up to the side? How is that?
Side's a little better.
Side's a little better, okay. And can you do the same thing but with your hand flat like that so that the shoulder's turned? How's that?
That kind of hurts.
Okay, so the most comfortable position was in with the thumb upwards, correct?
Mhm.
Okay. And then just with the shoulder like that. Any pain in the shoulder when you would do that?
Just a little bit.
Okay, I'm gonna have you rotate like that. How's that? That might be uncomfortable.
That's uncomfortable.
Okay. And then the last couple of things, are you able to put your arm back like this? Rotate the shoulder like that? Is that too uncomfortable?
Yeah.
Okay. And what about behind you like that?
Yeah, that also is.
Okay.
something good.
And is that mostly on the front here or in the back?
Mostly the front.
The
yeah.
front. Okay, yeah. So it's definitely this shoulder tendon right here. All right. I'm going to have you just do a little bit of strength, and I know it's uncomfortable, so I'm only going to have you make motions that I know are not super uncomfortable for you. So again, go up to the side like that, and can you just push against me here? Just come up. Okay, relax. I'm going to try the other side. Same thing, come up just with that side and push against me. Still much stronger on this side. And are you able to, again, do this one for me? And push it, me. Okay, a little bit of weakness there on the side. Yep, all right. So that's definitely causing some lack of range of motion, some lack of strength. To test the sensory. So if you don't mind just holding that right there for me. Perfect. And I want you to close your eyes and just say yes when you feel a little bit of a fluffiness like that, okay?
Yes. 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 Yes.
Okay. And do you feel the difference between this and that?
Can you do it again?
Mm-hmm.
Yes.
Okay. Tell me if it feels like a bit of a scraping, like a sharp, like that, or soft.
Sharp. Dull. Sharp. 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 Dull. 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 Sharp.
Good. I'm going to run. Well, first of all, how does this feel temperature-wise?
Feels cold.
Feel cold there?
Mm-hmm.
And there?
Mm-hmm.
Okay. It's quite a sharp tool right here, but I want to run it down the arm and just see if there's any change in the sensation. So what I'm looking for is if it's the same sensation all the way down. Is that the same all the way down?
Sort of, yeah. Maybe a little less at the top.
A little less right here? What about right here?
Yeah, there's a little less
At the top?
sensation.
And how about in the back here?
That kind of feels the same.
Still the same?
Mm-hmm.
All right, so it's maybe a little bit of swelling here right on the front. You can relax that hand. Because as far as, there's no sensation loss in the sense that you can feel everything. But if it's swollen, it's not going to feel quite as sharp, right? Because you've got a little bit of that water built up there, which I think is what you're experiencing. Gonna look right there just with a microscope here, magnifying glass rather. Just look really into the skin. What I'm specifically looking for is any burns, any abrasions, anything that could be causing the swelling from the surface as opposed to from the muscle. But I'm pretty convinced that this is a muscular strain, maybe a little bit of a tendonitis starting, especially in this front muscle because of that discomfort for some of those movements. And I didn't see anything of note. So, just taking some notes there that we did have a bit of swelling, a bit of sensory, not loss, but differentiation, weakness there, as well as strength is definitely affected, range of motion is definitely affected. Are there things that you're struggling to do with this shoulder, like how's putting on a jacket for you?
Yeah, it's uncomfortable right now.
Okay, so we definitely need to address it because it's affecting your everyday living. Are you having pain when you sleep? Are you able to sleep through it?
I've been taking ibuprofen at night, so it's been manageable.
Okay, and I do suggest you continue to do that, to take that pain reliever and that swelling reliever to keep that manageable at night, especially. Just make sure to do it on a full stomach, or you might have some stomach issues. Just going to do your reflexes, okay? Just make sure. So go completely relaxed. I know that's probably not the most comfortable position, but just try and relax fully. Not super brisk. There we go. Just check the other side. This side shouldn't be as uncomfortable for you. We'll start here. Good. Actually, both sides, that ulnar elbow reflex here isn't particularly reactive, so perhaps that's nothing to do with your injury and simply just how you are. And then let's just take a couple of measurements, but I think I'm pretty convinced I want to do a little bit of massage and point therapy on that shoulder to help loosen up that swelling and help relax the muscle, but let's just get the measurements of the swelling so we can track it, okay? So I'll have you just lift up slightly for me. Good, and relax. I'm just going to have you sort of turn the arm the other way. Yes, is that okay?
Mm-hmm.
Okay. All right, Jeremy, I'm going to have you just step out and change into a top that I can get to the shoulder and do the therapy on, and then we'll get you feeling a little bit better, okay?
Thank you.
All right, let's get started here. So again, just going to take a look. I want to focus mostly on this front part and the top of the shoulder and a little bit into the back, but it seems like the front was worse, right?
Mm.
Actually, because it's so irritated and I just want to get you relaxed for now, we just did a lot of work. I'm just going to do a little bit of a relaxation technique. Basically just a soft brush, nothing special. And just close your eyes. And we're just going to start to just calm down the body. Just sort of listening that initial nerve response here. Getting the mind's attention on this area. Starting out with just a little bit of cold scraping. Try and clear out some of that buildup, some of those toxins. Let me know if anything's too painful, okay, Jeremy?
Mm.
Can definitely feel a little bit of crepitus here. Do you feel ready for the point therapy?
Mm-hmm.
Starting out with our most dull pressure. It's got more surface area than all the other tools, and therefore it's going to be more distributed and less pointed. You can see how much swelling there is right here because of how much I can press into the shoulder. Flipping this tool around now, you're going to feel a little bit more intensity. Moving on to our next sharper tool. A bit more intense now. If it's too much, just stop me.
It's pretty uncomfortable right there.
Okay. How's that?
It's a bit better.
A little less? Point therapy, we want to stimulate healing, but we don't want to actually cause more pain. So it's a fine line, and it definitely means that the patient needs to communicate to the practitioner. Our last tool here is going to be sharp, and it is going to be uncomfortable. I'm just going to place it in a few key places. But know that there will be some discomfort here. Okay. Okay. So as always, what you can expect is that it will take a few hours to sort of calm down, the redness to go away, and then hopefully you'll start to feel some relief. But I do suggest coming back and doing at least 2 more rounds, okay? There's also some exercises I can send you home with that can strengthen these back muscles here and take some of that pressure off the shoulder while you're having the strain of the muscle and the tendon. I'm just going to note our session today. All right, Jeremy, so I've noted everything we've done today, that we've done a little bit of work on that shoulder, and I would love for you to just let us know how you're feeling in about 48 hours, okay?
Okay.
All right, any questions for me?
No, not right now.
Okay, thank you so much.
Thank you.